6. Sorry.
Oh, you're fine. We're back live here with Ava, who I keep wanting to call Ava. Avocado, maybe. Trying to. Yes. Jensen says, I know. I like to create names for the cats that aren't really there. They're intubating our beautiful girl right now. And that's because we're getting ready for the spay. So if you just tuned in, we did check that Ava, sadly, is 4-paw declawed. They did radiographs for baseline, and part of why we do radiographs, especially with her and her kittens, is we know there's a history of metabolic bone disease. And people say there's a lot of metabolic bone disease in servals. Well, that's not the case in the wild. What happens is servals do need more calcium than other species of cats when they're young. You can see how their bodies are built for the savannas of Africa and how they chase and kill prey. And so when people try to make them pets, 90% of this metabolic bone disease is an improper diet for servals in captivity. And so that's what's really, really sad, is it's 100% preventable. Dr. Joanne actually was taking radiographs. And tell us what you found, Dr. Joanne.
So Ava has a plate in her left leg at the femur. So she has had a broken femur in the past, likely from metabolic bone disease, and it has been plated.
Well, we're happy at least it was repaired, but it's sad that even the mother here has had some sort of injury or metabolic bone disease. We know one of the males that is going to another sanctuary from the seizure is pretty much missing part of his front leg due to a horrible injury and metabolic bone disease, because when they have metabolic bone disease, fractures happen so much more quickly because those bones are soft. So her kittens are patiently waiting over there.
Are you comfortable with that?
And Judson's filming. And they're prepping her for a spay. So we are going to sign off before any graphic surgery. If you've seen spays, they're not graphic for us, but we obviously don't need to show every spay and neuter. You guys would be live with us for 300 plus rescues we do over several years. But the good news is to celebrate is that Ava will no longer have to have kittens, no longer have to have kittens torn from her at days old to be sold to the pet market. And we are decreasing her risk of ovarian cancer and pyometra, which can be an infection. We don't know, hopefully what we're going to find, since she's a young serval, is that she has a healthy uterus and everything that we're removing. Sometimes when we spay breeder cats, it's very sad to see the condition of their uterus after being overbred. Now in the wild, she would have kittens probably every maybe 3 to 5 years, because she would be keeping her kittens with her and teaching them how to hunt for up to 2 years. Now in captivity, as soon as they pull those kittens from her to sell, she goes back into estrus, and oftentimes they rebreed these cats 2 times a year to sell kittens to the pet market, and that's not what their bodies are meant to do. So we're shaving her belly now and prep for her spay. Her blood had already been drawn. She'll receive vitamins upon waking up, and any pain management or antibiotic support the vets see fit. And then she'll also receive a microchip if they haven't done that already. A lot of times they're super quick and they get things done, multitask, especially when they have 4 animals on the docket today. Again, if you just tuned in, we just revealed that x-rays, radiographs showed that Miss Ava here had a broken femur at some point. We are happy that it was plated by a veterinarian based on the radiographs. We know that is not the case with some of the other cats that came from this seizure, and it is why it is so important that we do radiographs on these cats, because we're going to see arthritic changes probably in that area faster than you would with a leg that hadn't had a fracture and been plated. And luckily with the plate, you get a lot of support there, but it's something we're going to watch. And when you add that onto her forepaw declaw, as she gets older, we're going to want to watch those arthritic changes and any pain management or any, sadly, regrowth that comes from declawing one of these cats. And of course, at the Wildcat Sanctuary, we do not advocate declawing any wild cat. We want them to have all their teeth and claws, and they'll also be looking at her teeth and everything else to make sure we get a full picture of this beautiful girl. And while Miss Mama Ava is asleep, that we get as much information as possible, so once today is over, her and her kittens can just start relaxing and acclimating to life at a sanctuary. So we're going to be signing off, but tune in all day because we will be bringing you live with every cat here, and we'll hopefully, once they're sedated, safely be able to show you their individual faces. So as we post photos and things, you can start telling them apart just like we have. Obviously, Mama Ava is, she's 26 pounds, 26 and a half pounds. She's the largest, but we think the kittens, we're estimating them about 15 pounds. So they're not far behind, and they're almost 6 months old. So they are growing fast, and that's due to the loving care of the SPCA and the holding facility that held these animals after they were seized in June, waiting for the court case to be complete before they could be sent to their ever homes at accredited sanctuaries. And you guys make this possible too. We're always able to say yes when we receive the call because you guys always support our rescues, support our fundraising programs, and as always, remember, all of our residents are available for sponsorship. So if you're ever interested in sponsoring Ava and helping care for her and the rest of the cats at the sanctuary, Serval sponsorships are $300 a year or $25 a month. And they make great holiday gifts too for you or somebody you love, and knowing that you're helping a bigger cause.
If you want to cut, I will also
We'll talk to you soon.
Okay.